I'm David Mason, the Director of Public Health for the town of Sandwich, and we're doing second wave update number 4, and we will start off with Chief Burke with regards to the numbers.
All right, good morning, Dave. As of December the 2nd today, 10 active cases, 170 plus recoveries, and still the 3 deaths, those from earlier in the spring in the first wave. So we're kind of maintaining this 10 case count here recently, but we have noticed the uptick. Hospitals, I believe there's 25 at Cape Cod Hospital with at least 4 in ICU. In Falmouth was around 8 or 9, I believe, with 1 in ICU. Okay,
and we've had in our COVID team that we meet twice a week, Dr. Ryan Bemis is with us, participates also. I mean, at our last meeting, it kind of took me off guard as far as he was speaking to the sudden change in hospitalizations.
Especially at Cape Cod Hospital, I think, with the surge that's going on in Barnstable, Yarmouth area right now, and we're a couple weeks out from the election, and now we're just not even a week out from Thanksgiving, so we'll see what those numbers look like.
Okay, so it is concerning, and as we see the numbers go up, as Chief had mentioned, we're at 10 active cases right now. Our community is still in the green relative to the state's color coding. We are a low-risk community at the moment. The other towns surrounding us are at a high-risk category at this point. And you need to keep in mind that the governor's rating, color coding, relates to what we're going to be able to do as far as moving forward. The businesses in this town are subject to a phased opening approach, and if we go into the yellow or the red, steps are going to have to be taken, bringing us backwards. And if you recall in the beginning of all this, when we kept beaches open, we had said it's up to you whether we keep beaches open. It's up to you whether we keep certain businesses open and the schools open also. So we need to really stay vigilant in our efforts and distancing. Do we have anything else going on, Chief?
No, just a few things on the testing front. The county is looking to start their testing program next week. I've heard the fairgrounds in Falmouth is one site. There's going to be a Mid-Cape site, maybe at the Barnstable County Courthouse complex or in that area, and then something for the Lower Cape. It is appointment only. It is 2 days a week, what I'm being told now. And again, that's asymptomatic or just basically if you need a test, but it is appointment driven. Municipally here, with our testing program, we've been doing very well. We have rapid antigen test capability, antibody test, and nasal PCR. We've been able to stay ahead of a couple of potential issues. We've identified positive cases very early, been able to isolate, contact trace quickly, and keep things down to a dull roar. So we're going to continue with that. And we did meet with Dr. Gould this morning. One thing I will mention is we're looking at, and this will happen for post-holiday break for teaching staff, school staff. There will be a re-entry testing protocol very similar to the one in early September that we did. And this time we have the ability for both the antigen test and the nasal PCR, which kind of ups the game a little bit for us. And I think puts us in a good position to bring the kids back after the holiday break.
And a follow-up to that discussion with Superintendent Gould, there was the discussion, as people may be aware, the Barnstable school system went remote for a period of 2 weeks, and there may be some questions as far as what is Sandwich doing. At this point, we're not going remote. The school is not, based on that discussion we had today. You have to keep in mind, you can't compare our town or our school system to other towns. The school system in this town has done an excellent job of social distancing, and the level of communication for identifying cases and direct contacts are immediate, and we're jumping on those immediately. Whereas, the social distancing does not occur in some other communities because they don't have the ability to, and perhaps because there isn't the level of communication that we have interdepartmentally in order to control the cases. So at this point, we're running them to Christmas. and we'll talk more as we get into the Christmas holidays. The one thing to note as far as to date in the state, the largest number of active clusters are associated with family get-togethers, and we're seeing a larger number of cases come out of family get-togethers. So in this holiday season, keep that in mind. I know you heard from us and the CDC as far as getting together with for the holiday on Thanksgiving. The same is true with Christmas, and we're just really asking you to take a hard look at that and make decisions. Make those decisions. I know they're tough decisions, but for longevity, for our businesses, our school system, there is a need to maintain the protocols.
The other thing I'll mention, CDC looking to reduce quarantine time down to 10 days. It's actually 7 days, but you have to get a nasal PCR negative to clear you. So on technically day 11, you'd be released, but they have shortened that a little bit, which from a management point of view has been helpful. We have the ability to quarantine our staff for a lesser amount, but we can test them, and then we also test them on their first day back with a rapid test just to make sure. So overall, again, very proud of the municipal side and the school side, but the municipal folks working since May, following protocols. We have their backs with some testing if necessary, and we just got to keep this thing moving forward. I think keeping continuity of government open is critical, and we do not want to go backwards if we can.
For the discussion on the shortening the quarantine times, that's a good point to bring up for the general public, that if they are a direct contact and they're being quarantined, with the opening of the county testing facilities, they would be able to take advantage of that?
That's correct. So it takes a little bit of planning, but if you're a direct contact and you're told to quarantine, right around day 4 or 5, if you're non-symptomatic, is the time to secure a testing slot for around day 7 or 8. And you got to figure a 48, 72-hour turnaround time on the test. Once you get that negative PCR test back, then you're back in the game. And I think that even shortening it by 3 or 4 days, I think is helpful for people. And definitely from a management point of view, getting people back 3 or 4 days earlier is definitely important.
I think that's something we'll put in writing too, as far as people probably catching us what we're saying here, but we'll put that information out in a documented form so you have that, because as Chief had mentioned, it does take some planning, but it does save you some time in quarantine. So we will put more information out about that in the near future.
That's it.
Anything else, Chief? No. So I guess we'll wrap that up. We will be doing our next PSA next week, and again, start planning around your family holiday for Christmas, and we'll speak to you more about what's occurring with the schools as time passes. Be safe.
Thank you.